Hi everyone and welcome back to this Javic Healthcare video. Today our topic is on how to use an ambulatory bag for patients on mechanical ventilation who are experiencing acute respiratory distress syndrome, ARDS. When it comes to patients on mechanical ventilation, there are three important things that we should know. The first one is how to assess the patient's needs for manual ventilation. We should also understand how to identify and troubleshoot for any complications. ARDS is a severe lung condition that impairs gases change, and with this there is a need for supplemental oxygenation. There are also certain equipment that will help us out. First one is an ambulatory bag with oxygen reservoir. The second one is a bag mask valve. The third one is an appropriate mask or endotracheal tube connector. And the last one is a pulse oximeter. Now we can go over to patient assessment. The first step is to make sure that the patient is stable enough to tolerate a brief period without mechanical ventilation. The second step is to check the oxygen saturation, the end tidal CO2, and also check if this patient has any signs of respiratory distress. We need to confirm that the ventilator alarms are working and also confirm that there is a need for this patient to transfer to an Ambu bag. We need to also inspect the Ambu bag for integrity and function. Then we can attach the Ambu bag to 15 liters of oxygen, ensuring that there is a good seal between the mask or the tube and the bag. Now we go over to the techniques for ambulatory bag on ARDS patients. 1. Patient positioning. We need to place the patient in a semi-recumbent position so that with this we can optimize the lung capacity and oxygenation. 2. Ventilation technique. We need to avoid over hyperventilation. We deliver the breath slowly, targeting a respiratory rate of 10 to 20 breaths per minute. Then we use a low tidal volume. We need to manually estimate and deliver the tidal volume to an approximate of 4 to 6 milliliter per kg of body weight. Then we need to ensure adequate expiratory time. Patients with ARDS are prone to air trapping. Therefore, we need to provide sufficient time for them to exhale. Number 3, we need to ensure that there is a visible rise and fall of the chest with each breath. Also, we need to avoid excessive trauma because you know that patients that have acute respiratory distress syndrome are prone to barotrauma. We need to also monitor the oxygen saturation. I would say a target saturation of 88 to 92% is ideal. Finally, we need to monitor for complications. The first one is barotrauma. Excessive pressure can result in lung injury. The second complication is hypoventilation. If there is an inadequate rise and fall of the chest, or if there is poor oxygenation, we need to reassess the seal. The third complication is oxygen desaturation. Here, we need to be prepared to increase the flow rate if the oxygen saturation remains low. In case there are problems, this is how we can troubleshoot. Check that the seal is tight and the mask fits. If we need to, we can reposition or adjust the mask. If we're using an endotracheal tube, we need to make sure that it is not dislodged or obstructed. 2. If there is a difficulty with the back compression, we can check the airway for any sort of obstruction and also suction the patient if there are secretions. If the oxygen saturation continues to remain low despite all the efforts you've made, please consider increasing the oxygen flow or reassessing the tidal volumes. Now, after the procedure, number 1 thing you should do is accurate documentation. Document the duration, the reason for the manual ventilation, the patient's response, and if there are any issues that you encountered. If the reason for using an Ambu bag is because there is a problem with the ventilator, please consider transitioning the patient back to manual ventilation if the issue with the ventilator has been resolved. Lastly, here are some key points to remember. Number 1, please keep in mind and always try to remember that patients who suffer from acute respiratory distress syndrome are highly vulnerable and prone to ventilator-associated lung injuries. So always use low tidal volumes if you can and avoid using high pressures. Please monitor the oxygen and ventilation parameters closely and of course adjust as necessary to maintain stability. Finally, please regularly assess patients for any signs of complications and be prepared to troubleshoot as necessary. Thank you so much for watching this video and I'll see you in the next one. Bye, and please don't forget to subscribe to our YouTube channel so that you do not miss any video. Okay, bye.